Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology. I'm board certified in obstetrics and gynecology and I'm licensed to practice medicine in both Florida and Alabama. Patient rights. We hear a lot of talk about not only patient rights, but actually patient bills of rights, where a patient has the right to be respected. The patient has the right to be treated as a person. The patient has a right to informed consent, where the risks, benefits, indications, and alternatives are clearly described to that patient before they have surgery. Well, let's go back and see who is a patient. Well, a patient can be me. I'm a physician, but I can be a patient as well. A patient can be somebody that comes into our emergency room and isn't even conscious. Well, we have a duty to still respect them as a person and to do what we think they would want us to do, even when they can't communicate to us. But we also treat the preborn as patients. It centers around the country, and now Florida as well. Surgeries are being done on the preborn on the inside of the womb. At Winnie Palmer Hospital over in Orlando, they are now doing spina bifida surgery as early as 19 weeks gestation. Why are they doing the surgery? Because they're trying to prevent future problems and future issues. There's a defect in the baby's spine. This defect doesn't just affect the spine, the defect can affect the brain as well, and it can cause problems with ambulation, problems with control of the bladder, problems with control of the bowel. If we operate on these kids while they are still in the womb, we can prevent those future problems. Problems where a kid might have to have a shunt placed, a drain which goes from the brain and down to the abdomen. That's why we're treating the preborn as patients. But when we treat the preborn as patients over at Winnie Palmer Hospital, and they're doing amazing work, what's also amazing is that in Orlando, the lives of the same gestational age kids up to 24 weeks gestation, those lives for no reason whatsoever can be taken in the form of an abortion. How can we have on one side of the city of Orlando an amazing hospital that treats moms as patients and babies in the womb as patients? When they wheel mom into the operating room, they say we are wheeling two patients into the operating room. How can we have amazing surgical advances on those patients in the womb on one side of the city, yet on the other side of the city, kids that are either further along in their pregnancy can be aborted? A patient is a person, no matter how small. If they are a patient, they are a person. If they're a person, they need to be protected. We need to understand this concept. We were created in the image of God at that moment of conception, and life is a gift. And as physicians, we need to respect that life and do everything we can to preserve and protect that life. If you have any questions, you can get a hold of me through my website, prolifedoc.org. God bless y'all, and y'all have a great day.